Welcome to A to Z of Nursing. Here we have another video on the pap smear. Let's dive into the video. The invention of pap smear. Papanicolaou smear or the pap smear or cervical smear is a safe non-invasive cytological examination for early detection of cervical cancer. During the 1900s, cervical cancer was one of the leading cause of death among the women. It was until the year 1928 where a Greek physician, George Nicholas Papanicolaou, was able to discover the difference between normal and malignant cervical cells by viewing the samples microscopically, hence pap smear was invented. For women ages 30 and above, this procedure can be done in conjunction with a test on human papillomavirus, the most common sexually transmitted disease and primary causative agent for cervical cancer. The American Cancer Society recommends a pap smear at least once every 3 years for women ages 21 to 29 who are not in a high risk category and who have had negative results from 3 previous pap tests. While a pap test and an HPV test is recommended every 5 years for women ages 30 to 65 years old. If a pap smear is positive or suggests malignancy, a cervical biopsy can confirm the diagnosis. Nurses play an important role in promoting public health awareness to inform, encourage, and motivate the public in considering health screening such as pap smear. This pap smear study guide can help nurses understand their tasks and responsibilities during the procedure. Indications of pap smear. Identify the presence of sexually transmitted disease such as human papillomavirus, herpes, chlamydia, cytomegalovirus, actinomyces, trichomonas vaginalis, and candida. Detect primary and metastatic neoplasms, evaluate abnormal cervical changes, detect condyloma, vaginal adenosis, and endometriosis, assess the hormonal function, evaluate the patient's response to chemotherapy and radiation therapy. These are the factors or conditions that may alter the outcome of the study. Number 1. Delay in fixing a specimen, which allows the cells to dry, therefore destroying the effectiveness of the stain and makes the cytologic interpretation difficult. Number 2. Improper collection site may cause rejection of the specimen. Samples for hormonal evaluation are taken from the vagina, while samples for cancer screening are obtained from the vaginal fornix. Use of lubricating jelly on the speculum that may affect the viability of some organisms. Specimen collection during normal menstruation since blood can contaminate the sample. Douching, using tampons, or having sexual intercourse within 24 hours before the examination can wash away cellular deposits. Existing vaginal infections that may interfere with hormonal cytology. Equipments used in pap smear: a pair of gloves, speculum, fixative spray, water-based lubricant, pencil, liquid cytology, glass slides, jumbo swab, broom, spatulas, and a cytobrush. The pap smear procedure. Pap smear is performed by a practitioner and takes approximately about 5 to 10 minutes. The step-by-step procedure is as follows. Number 1. The patient is positioned. The client is assisted in a supine, dorsal lithotomy position with feet in stirrups. Number 2. A speculum is inserted. The practitioner puts on gloves and inserts an unlubricated plastic or metal speculum into the vagina and is opened gently to spread apart the vagina to assist the cervix. The speculum may be moistened with saline solution or warm water to make insertion easier. Number 3. Cervical and vaginal specimens collection. After positioning the speculum, specimen from the vagina and cervix are taken. A cytobrush is inserted inside the cervix and rolls it firmly into the endocervical canal. The brush is then rotated one turn and removed. A plastic or wooden spatula is utilized to scrape the outer lining of the cervix and vaginal wall. Number 4. Collection technique. Using the conventional collection method. The specimen from the brush and spatula is wiped on the slide and fixed immediately by immersing the slide in equal parts of 95% ethanol or by using a spray fixative. Number 5. Collection technique. The brush and spatula are immediately immersed in a thin prep solution with a swirling motion to release the material. The brush and the spatula are then removed from the solution and the bottle lid is replaced and secured. Number 6. Label the specimen. The slides are properly labeled with a patient's name, age, initials of the healthcare provider, collecting the specimen, date, and the time of collection. Number 7. Specimens are sent to the laboratory. The specimens are transported to the laboratory for cytologic analysis. Number 8. Bimanual examination may follow. After the removal of the speculum, a bimanual examination may be performed wherein the healthcare provider will insert two fingers of one hand inside the vaginal canal to feel the uterus and ovaries with the other hand on top of the abdomen. The nurse's responsibility before the procedure. The patient's consent should be secured. Obtain the patient's health history, which includes the parity, date of LMP, surgical status, contraceptive use, history of vaginal bleeding, history of previous pap smears, and the history of radiation or chemotherapy. Ask the patient's current medication list. If the patient is taking a vaginal antibiotic, the pap smear is delayed for 1 month after the treatment has been completed. Explain that pap smear is painless and ask the patient to avoid interfering factors like having sexual intercourse within 24 hours, douching within 48 hours, using a tampon, or applying a vaginal cream or lotion, which is to be avoided before the test since it can wash away cellular deposits and change the pH of the vagina. The bladder should be emptied. Pap smear involves the insertion of the speculum into the vagina and could press down the lower abdomen. Nurse's responsibilities after the procedure: cleaning the perineal area, providing a sanitary pad, provide information about the recommended frequency of screening, answer any questions or fears by the patient or family. Anxiety related with the pending test results may occur, so discussion of the implication of abnormal test results on the patient's lifestyle may be provided to the patient. The results. Normal findings in a pap smear will indicate a negative result, which means no abnormal malignant cells or atypical cells are found. While a positive result signifies that there are abnormal or unusual cells discovered, it is not synonymous to having cervical cancer. The Bethesda system, TBS, is the current method of interpreting cervical cytology, and it includes the following components. Number 1. Adequacy of specimen. Satisfactory for evaluation. Describe the presence or absence of endocervical transformation zone component and other quality indicators such as the partially obscuring blood inflammation. Unsatisfactory for evaluation. Specimen is rejected or the specimen is processed and examined but unsatisfactory for evaluation of epithelial abnormalities. Interpretation of the results. Negative for intraepithelial lesion or malignancy, which shows evidence of organism causing infection. Trichomonas vaginalis, fungus in organisms morphologically consistent with Candida. A shift in flora indicative of bacterial vaginosis. Bacteria consistent with actinomyces. Cellular changes consistent with herpes simplex virus. Other neoplastic findings may include reactive cellular changes related to inflammation, radiation, intrauterine device use, atrophy, glandular cell status after hysterectomy. Thanks for watching. If the contents of this video are informative, like the video and share the video with your friends and colleagues. Subscribe the channel for more videos. Thank you.